afternoon. Thank you for joining me today. My name is Hendrix. I'm an occupational therapist, and I hear that you were referred here for some support because you've been facing some challenges and changes since your injury. So I'd first like to get to know you a little bit. If you could please introduce yourself, or how can I refer to you?
Hi, my name is Emily.
Emily, nice to meet you.
Nice to meet you too, Hendrix.
And I'd like to know a little bit about what do you know about occupational therapy?
I don't know much.
Okay.
Yeah, I looked into it a little bit before I came here, but other than that, I'm not sure.
All right. So if it's okay with you, I'd like to talk a little bit about what we can provide as services, and maybe use this time to learn about you and maybe set some goals, if that's okay.
Yes.
So occupational therapy broadly looks at your life, your daily activities from the moment you wake up, how you go day to day, how you navigate the community, how you support yourself, how you support others, and the challenges that you face and that impede in that, whether that's a physical condition, an injury, or a change in life circumstance. So tell me why you're here today.
Yeah, so I'm having trouble, in my regular day-to-day because I'm in a lot of pain.
Okay.
I'm not the type to constantly take medication, so, I kind of just deal with it. I have some issues with my feet. I tend to limp a lot, and I have to go to work. And my job requires me standing. I stand a lot. I have to walk around a lot. I also tend to lift things. I do inventory sometimes. So, it's affecting me because of the pain. And sometimes I get up and I'm just like, I just can't do this. I don't want to go to work. And, when I get to work, because of the pain, I'm just so irritable. I just don't want to be there.
So your work requirements is very physically demanding, and because of what you're experiencing, you said you're experiencing pain in your leg. If I heard correctly.
It's my feet.
Your
yeah.
feet. Okay. Have you seen a physician and received a diagnosis for that?
Yeah. So I just went. I didn't have insurance for a little while. I just went to a urgent care.
Okay.
I expressed, what's going on, and they said that I have a few issues. So I do have plantar fasciitis, heel spurs, and sciatica.
Okay.
I went to see a specialist for it, and they're trying to help me, but I think it's not working as much. I guess I'm not doing the exercises I'm supposed to be doing, and it's just yeah.
So you saw a provider, you received a diagnosis of plantar fasciitis, and you said you're experiencing pain as a result of that, and medication is not something that that you feel is helping managing the pain. You've mentioned a little bit about how that's affected your work demands and how that's created some frustration, especially in waking up in the morning because you have to go to work, and you're looking for a way to manage all of this.
Yes, exactly. Yeah. Yeah, I guess I'm having a little trouble. That's why I'm here, managing it myself. I guess I just need more self-realization because I can't deal. I just need, I guess I'm starting to lack that motivation.
Well, tell me a little bit about the morning for you, and how you're getting ready to go to work, and what strategies have you been using there to get yourself to work and to perform the duties there, despite your diagnosis?
Every time I wake up in the morning, I have to rush.
Okay.
I tend to wake up just in time, and I rush. I have to walk my dog, which takes some time. And when I first wake up in the morning, that's when it's the most painful for me. And having to go and get myself ready, take the dog out for a walk, it's really hard. And by the time I get to work, I use public transportation. It takes me a little while to get there. And at work, I do have to move around a lot, stand up a lot. I'm interacting with the guests, the patients. I'm trying to like keep my composure, you know, trying to hide the pain, but sometimes it's a little difficult. But that's basically it. Yeah. And I come home, I go to the gym. The gym actually has been helping with the pain. I guess because it involves like exercise and stretching in its own way. I feel a little better after, but then when I get home, it's like back to the pain, and it's like a whole rotation that I'm going through.
So going to the gym is something that's helping, being able to exercise, and it's something that's important to you. In some ways, it's a way for you to get out of work, get out of your morning daily responsibilities. I also hear that you have a dog, and that you have to walk your dog, and so there's several things that that you identified in your day-to-day that's really important to you.
Yeah.
What would you say is the most important thing that you could work on right now? What would you say is the most important activity that you would like to see improved in?
I guess I don't get much rest.
Okay.
I'm like, because there's always something to do. I live alone. I have my dog. When I get home, I have to walk her again, of course. I cook for her. I have to cook for myself. You know, cleanliness is very important to me. So I feel like I have to find more time for rest.
Okay.
I think that's really important for me.
So rest. So the ability to find time for rest and a full night of sleep, maybe waking up refreshed, helps you start the day very strong. And you've also mentioned that you feel the pain the most in the morning, and presumptuously that could be due to poor sleep or poor rest. So the fact that that you're having poor sleep creates that very difficult start to your morning because you're experiencing pain.
Yes, I believe that's that's it. It's the lack of sleep and the lack of letting my body rest.
Okay. So
I just I don't know, actually. I mean, I don't really know where to start and how to really help myself, because the gym is very important to me. You know, also my dog is very important to me. So I always have to find time for that, because just like my future, and the gym is what is important for my future as well. I need to. So, you know, I mean, I guess I could spend less time at the gym, but I don't know. I think it's like,
but you're looking for a way to find balance. Balance is
Yeah.
important to you. Rest is important. So finding balance is important because you're looking for rest. You're looking for a way to manage your morning routine so that you feel that you have the energy to perform at work, and then come home and do everything that you need to do as well. Continue to walk the dog. Make time for the gym.
yes, exactly. Yeah, I guess I can take less hours at work. I don't know. Just, I don't.
Well, it's so. But work is important to you, right? You have to manage.
Yeah, I have to pay the bills.
Right.
But I do I do exhibit a little frustration at work. People kind of notice I could be a little moody, but it's not even anything to do with work or them. It's just, you know, what I'm feeling, you know. So I guess I don't really know how to help myself. I know what I want, but I just don't know how to go about it.
Okay. So I'm going to go back a little bit to the idea of rest, because that was what was important to you.
Yes.
What strategy? So tell me a little bit about your, how are you setting yourself up for rest in the evening? So you've gone to the gym, you've walked your dog. How are you getting yourself ready for rest? If you could tell me a little bit about how are you making time for that?
So straight after work, I go to the gym. Then I have to kind of rush home for my dog, because she's been so many hours alone. So when I get home, I walk her, feed her, and then I have to, if I don't have anything, I have to eat, I have to cook. Sometimes I don't have the energy to cook. I'll eat out, which is a problem because it's like, but I guess maybe I just prepare myself for bed. I shower, you know, change, and I guess I take a moment, you know, play with my dog or, you know, cuddle with my dog. I don't really do much. I don't have much time. So by the time I get home, I'm either like picking up, cooking, you know, preparing myself for bed.
And so you, how is the injury impacting you with all these different activities when you're getting ready for bed?
After the gym, it doesn't hurt as much, so it helps. It's just, but then when I'm laying in bed, it does hurt. Like
Okay.
I am in pain, and then when I wake up in the morning, I feel the pain. So I guess I don't know. Maybe I'm not sure. It's just I don't know what to do. I guess I can go straight to bed, I guess. I don't know. I have no idea what to like, how to include this for myself.
Okay.
How to get more rest.